so we met today, and can you tell me why you came to see us in the first place? What was the driving reason?
I have some broken teeth in the front.
Right.
And that was really the initial reason
Sure.
for coming.
And you were telling me that you've had a long history of having restorative work done, porcelain crowns and what have you, or root canals.
I'm constantly going to the dentist with
Yeah.
cracked teeth, broken off crowns, worn down, gold crowns, worn holes through them. I have veneers in the front. Those are constantly breaking off. I've even had to have an implant because that veneer has broken so many times that,
Sure.
there was no tooth left. Yeah, so we had to do an implant.
So what did your previous dentist tell you was going on with that? What was the reasoning as to why
Just
that
that I had
happened?
strong jaws and that I was probably grinding my teeth.
Okay, did they ever try to make you any kind of splints or anything like that?
Yeah, we did the bite guards, the regular
Right.
acrylic bite guards that snap on top and bottom. We've tried both.
Did that help?
No. I broke the backs off of them,
Sure.
of the guards, or wore holes in them.
I was talking to you about how the joint and orthopedic thing might be going on. Does that make sense to you?
Absolutely, yeah, it does.
And and you were asking me like, well, how could that have happened? And I was describing to you that trauma, like being a guy or a girl playing around as a kid or as an adult, or having experienced a whiplash injury or something like that and tearing ligaments. And I showed you what cartilage can do to the jawbone and how that translates into what happens to the teeth, right?
Right.
Does it make sense?
Yeah.
So so instead of trying to replace your broken crowns right away, which is what the vast majority of my brethren would do in my profession, I suggested that we take a look at your joints. And that makes sense to you, right? Can you tell me what was running through your mind? Did it?
Well, as I started looking at the video and thinking about the dynamics of it and the injuries that could possibly have occurred in my lifetime that might have caused something like that,
Yeah.
I started remembering, okay, yeah, I flew over the handlebars of a bicycle when I was 10 and, hit my head
Yeah.
somehow. And I've had an auto accident where I've hit my head and I've had whiplash. And, there have been other situations where I've had injuries that it ties to the possibility that I could have something going on in there. And the other thing is, I didn't even notice the question, to be honest, on the questionnaire, but about the neck pain. I don't have pain in my jaw. I just haven't really had that problem. But I have constant neck, like my neck is sore a lot, most of the time.
Well, let me give you a quick explanation, potential explanation. And I'm not really qualified to take it all the way for you, but so let's say you incur a macro trauma, a blow to your head, which is connected to your neck. So your TMJ has ligaments with cartilage, right, which we discussed. Well, about 3 or 4 inches away, you have ligaments separating vertebrae in the upper cervical spine. Why wouldn't you have damaged your upper neck when you damaged your TMJ? These things happen simultaneously. See where I'm going with this? So it's possible that, and likely, I know I'm damaged like that in my life's experience. It's likely that a lot of us with stiff necks and problems like that, it's an orthopedic injury where we stretch or torn ligaments. And the cartilage isn't being held in place quite right. So muscles are responding by trying to brace. They're trying to make up for a hard tissue orthopedic issue, or soft tissue if you think about the ligaments and the disc itself. But that's a potential reason as to why you have these things going on. And a lot of us that are less fortunate, we tend to have quote-unquote TMJ problems that are symptomatic, like headaches and neck pains, and nobody can figure out what it is. Because the reality is it's across many professions. Just because, I can talk a little bit about the neck, but I can't treat it, because I'm a dental guy. Right? Whereas the chiropractor or the neurosurgeon, he doesn't talk about jaws. That's not what he does.
It's like trying to blend software versus hardware versus the interface that works between them, and very few people are actually doing all of it.
How about, exactly. How about trying to line up Apple and Microsoft and Linux and run it all on the same computer? It's like different languages, so people don't get along in the health field, so all this kind of stuff gets unrecognized and undiagnosed. So what I'm trying to say is, you become an annuity dental medicine, to dentistry, whatever you want to call it. I call it dental medicine because I'm thinking more than just dental and teeth. You're an annuity because no one's identified the problem. We need to establish if your joints are stable and adapted biomechanically before we go into messing with your teeth. because you've already been through that numerous times, and you've lost things and broken things, and you've spent loads of money.
Yeah.
And I assume you're fed up with it. I would be.
Yeah.
Yeah.
Like I said, I have a small car in my mouth already. A very expensive car.
Yeah. Is there anything you'd like to tell like other professionals or other patients about this? I mean, it's kind of a eureka thing, right?
Yeah, I mean, it just makes sense. When I started seeing the measurements and how I'm biting on my teeth and
Yeah.
where the pressure is being applied and how
Yeah.
it's wearing, I mean, it made sense that that's why these teeth are breaking down and banging against each other as they shouldn't be, and why I'm constantly having to go to the dentist.
It's like a
because
machine
just-
out of alignment.
Yes, exactly. It's just hitting wrong on the wrong places all the time.
Yeah. And you see, it's not just teeth. See, the normal dental guy, he's gonna think just teeth. You've got teeth connected to a mandible, the lower jaw, that has two hinges up and towards the front of the ear, and that hinge called the TMJ, and there's two of them. So we basically have a three-legged table. We've got joint, and teeth. I'm trying to look at all 3 points for you before we commit to replacing broken things. And if nothing else, we're going to identify and find a baseline for you of what's going on here. And I doubt you're going to need something like surgery or anything like that. This is very common stuff, but it goes unidentified. People deserve to know what's going on.
And I respect that.
Strong
I mean,
jaws.
I'm actually relieved to find that there could be a real resolution
A rational
for what's
reason.
going on here.
Yeah.
Yeah.
So, and if you wind up having stable and adapted joints, I talked to you about how we can adjust bites very precisely in time, and how that will often shut down muscle if that's the primary reason for your muscle overworking. It's possible that if we just work on that third leg of the table, we might be able to make things more stable for you. And that would be awesome, wouldn't it?
Yeah.
Yeah, so, yeah. Well, thank you very much.
You're welcome.